what time it is. Marvin Devine, Huber, Axel, and you know how we do.
Yeah, I got the juice, yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, just wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof.
You already know what happens when we link up. Let's go.
Yeah, I got the
Hello and good day. Welcome to another broadcast of Kidney Hub East Africa. I am half your host, Steve, the Kidney Nurse. Welcome. Thank you guys for joining. Today, we have an exciting, well, it's not an exciting topic. Let me take that back. We have an important topic to discuss today, and that's conservative therapy. And so let me bring on our other host all the way from Kenya, the kidney ambassador, Moses Kennedy. Let me give him the VIP intro. All the way from Kenya, Nairobi, Brother Moses Kennedy, the kidney ambassador. Good day, Brother Moses. How are you doing?
I'm doing, Brother Steve. I'm good. Really great. Yeah.
What's going on? You had dialysis yesterday. How you feeling?
Not much strong, but encouraged to move on, to fight on.
Okay.
Yeah.
Okay. So today, Brother Moses, our topic is conservative therapy. Now, before the show, you had mentioned that a lot of Kenyans or brothers and sisters that are on dialysis there, or just in general, would not think this route because of possibly religious reason of not doing dialysis.
Oh, yes.
Talk to us about that.
Yeah, you know, one thing to talk about not doing dialysis will simply means some form of irresponsible because majority of your support system who almost 100% are not aware about this route. Because remember, Steve, this route, it has to be explained to you extensively. But then, because I had mentioned earlier that when kidney patients walk into to hospital or seek medical attention, it's always too late and it's always in stage 5. And some of them crashed into dialysis like myself. So it means that route is completely new. And now the support system surrounding you will believe that this is a form of either some form of suicidal thoughts because you are refusing to for dialysis treatment, which is much more believed to be the only route for treating kidney failure. So,
right.
Steve, I hope you understand my point.
Oh, absolutely. I
Yes.
understand. I mean, I
Yes.
completely understand. So let's go ahead. Do you have something else to say?
Yeah. So many a times it is not easy to explain this route. I know that is why doctors don't have time to explain this route to patient or to their caregivers or to the support system. They only say you are going in for this kind of treatment, dialysis, and then you begin even without your consent, saying yes or no. You will have to, because they know that in a way they are also saving you, because there's no time of explaining so many things. And that is why this route is a new route. And this makes Kidney Hub East Africa more relevant in giving information. Yes, back to you, Steve. Thank you.
Right. So let's talk about thank you, Brother Moses. Let's talk about conservative therapy. I mean, basically, here in the United States, I can't speak in Kenya or East Africa, any other parts of East Africa, but here in the United States, conservative therapy is another option, just like outpatient hemodialysis, peritoneal, transplant. Conservative therapy is also an option here. The decision is yours. The decision to do dialysis is personal. That's a personal decision, because you can have someone, the doctor say, hey, we got to start dialysis, your kidneys are failing. And they may say, I don't know if I want to do that, doc. And then they may talk to them and persuade them. But dialysis and transplant are life-saving treatment options. Again, they're treatment options. They may extend life. They may reduce symptoms of kidney failure. For many people, it may even improve the quality of life. Okay? But not all people have the same goals when it comes to treating an illness. Not everybody has the same goal. Some people choose not to start dialysis. Okay? Some people choose to start dialysis and then stop. They probably say, I had enough. You have somebody been on dialysis 10, 15, even 20 years, and maybe they developed another problem, maybe cancer, or another issue that renders their life not they figure they don't have a quality of life. They may like I'm just tired. And you can't criticize or fault anyone who makes a personal decision to stop a treatment. So why would someone do this? You may ask. You have a lot of people like, this is a life-saving treatment. Why would one not decide to do dialysis, or why would one stop the treatment if they're living, they see their family? Why would they want to stop? Well, there are many possible reasons for this. Many. Some of us sense the end of our road coming. You can't be in someone else's shoes to know how they feel. You ever heard the term, walk a mile in my shoes? But some of us, or some people, may sense the end of the road coming for them. They may not see symptoms improving. There may be too much pain or suffering. What do you tell a person if they're suffering 24 hours? You can't tell someone how to gauge their pain. The burden of dialysis treatments may be overwhelming for a lot of people. There may be spiritual reasons. There might just be the hope to spend whatever time one has left with their loved ones instead of a dialysis chair. Because we know dialysis takes away time from your family. Now, this is not a show of promoting stopping dialysis or conservative therapy. We're just having a discussion and letting people know that there is another option called conservative therapy that is rarely talked about. So, whatever the reason, we all had a right to choose treatment. We also had a right to change our minds if the treatment we originally picked no longer fits our needs and goals. That treatment could change over time. For many people, they could probably start off, then next thing you know, they got to get multiple dialysis access. Then the doctor comes down to them and say, look, we're at the end of the road for access. We got to keep this as long as possible or find you a transplant. Now what? So this was a situation with a young lady who documented her time on dialysis on TikTok and made the decision to stop dialysis. Then she documented her time in hospice. I had nothing but respect for this young lady because she did what she thought was best for her. And that, unfortunately, that's how the dice rolls with this disease. It may leave someone with no other option but this option because they're in so much pain or agony, or this kidney disease has caused so much burden in their life that they're finished. How are you going to tell somebody, pray about it, and they've been praying, and after they shut down the camera and they off social media, they alone in their apartment or wherever they staying dealing with this disease? It ain't nobody from social media there consoling them. in real time, they're by themselves in whatever faith or spiritual person they believe in. So this is no game when you're talking about picking your treatment option. And it goes the same for anyone else who decides to go with hemodialysis or peritoneal or transplant. It's unfortunate that there's risk and benefits to each treatment option, whatever you choose, and you're rolling the dice. You can decide to get a transplant, get the transplant, and leave the hospital without the transplant because of some hiccup. This is just the truth of the matter, because there's people who have dealt with this. Maybe they developed a small clot in the renal artery and it blocked the blood flow and they lost the kidney. Didn't even make it out the hospital. I don't think they would want somebody to criticize the treatment choice they made and now it didn't work. So this is the risk and benefits of this disease. It's not a one size fit all. So let's talk about, Brother Moses, what is conservative therapy? Because, I mean, it involves not doing dialysis, but it also involves other things as well. Conservative therapy centers around the decision to not do dialysis. This might mean never starting dialysis. This might mean starting dialysis and then choosing to stop. But that's not all. With conservative therapy, doctors will focus on keeping you comfortable. They don't say, okay, you're not going to do it, we're going to leave you alone. No, they focus on keeping you comfortable. They're going to use therapies to keep you as healthy as possible during your remaining life. Remember, stopping dialysis does not mean your doctor stopped caring for you or about you. Your doctors will work with you and your family to provide you the support you would need during this time. Can you hear me, Brother Moses?
I can hear you.
Okay, I'm freezing up. So the new browser didn't work. So let me just speak about what happens without dialysis. We all know without dialysis, many people will pass away within a few weeks. However, this time frame could be very different depending on factors, including if you still make urine or not, if you still pee, other medical conditions, fluid control, and diet. After you stop dialysis, doctors can prescribe medications and treatments to make you comfortable. In the end, and we don't know when the end is, in the end, toxins and fluids will build up. They will become too much for your body, and then you'll eventually pass away. What are your thoughts, Brother Moses? I know I said a lot.
Very true, Steve. You know, this subject at times it confused so many of us, including myself, because at the same time, you know very well that when you stop dialysis as a patient, as a kidney failure patient, then the life expectancy is about 2 weeks, I guess so. And again, what happens if now I choose this route, conservative therapy? We must put it also clear that when one chooses this route, is especially to make life comfortable. That is number one, and that is actually, I mean, that is basically the primary reason why one will choose this, because if you feel you cannot continue with maybe dialysis or after transplant, then you need to take it further and know that this route is not curative. It doesn't cure kidney failure. It doesn't. It is just one of the routes that a patient can opt, and it cut on life expectancy. I don't know whether Steve, that is just my opinion. I don't know what is really correct. Back to you, Steve.
All right, thanks, Brother Moses. So let me just go back over this conservative therapy for a second. So let me give you an example. Let's say if somebody right now watching has stage 4 or stage 5 kidney disease. They go to the doctor, but they feel okay, and the doctor says, I want to go ahead and start you on dialysis right now. If this person mentions, say, Doc, look, I want to try conservative therapy. Let's try to manage these symptoms. And when it gets to the point, if it becomes overwhelming for me, then let me start treatment. Because some people feel like they started, I done talked to many patients, because I work in different clinics per diem, not full-time or part-time, but whenever they need me. But I've talked to many patients that said, I feel like the doctor started me on dialysis too early. They still having a lot of urine output. They're cramping. And they feel like why am I on here? And so if they don't know about, this is where education comes in. Knowledge. Because if they knew about conservative therapy, they say, Doc, I heard conservative therapy is managing my symptoms. It centers around not to do dialysis right now and managing. And we're going to get into the aspects of conservative therapy, because it's some people that, again, said, why did you start me on dialysis? And I still urinate a lot of urine. I go 2, 3, 4 times a day. And they still have me on dialysis. But again, if they knew about conservative therapy, they can hold the discussion with the doctor. And the doctor can't say, oh, there's no such thing as conservative therapy. But it's almost like if you don't ask, they're not going to tell you. They had that in the military here for people who were, quote, gay. And that, and you're in the military, if you don't ask, they won't tell you. Don't ask, don't tell. So it's important to know this information, because for a lot of people, maybe they didn't need to start dialysis the time that they did. Maybe they could have waited another 5 months, another 4 months, 6 months, or even a year. But if you don't know about conservative therapy, only thing you know, just get on dialysis, and you don't know about that, then how are you going to have the discussion? You're not going to come in, you're not going to be armed. You want to come in with the bazookas, of information, so the doctor can say, oh, it ain't no such thing, or that's preponderance, or whatever they may say to get you to start, so they can start billing the insurance. So again, it's not all about just stopping dialysis and going away and until you pass away. But this is an option for people who have multiple, as we call it, comorbidities or other medical issues like HIV, maybe cancer that has metastasized and is spread it. And your life expectancy is really poor, or the prognosis, and you're still doing dialysis. So say if you have cancer and you having pain, and now you're at dialysis, just sitting in the chair for 3 to 4 hours in pain. They don't have no morphine or any of that there. It's just Tylenol. And you're like, I can't do this, sit here for 4 hours in pain. So these are the times where conservative therapy may play a role. Now, reducing pain and symptoms in conservative therapy. If you choose conservative therapy, it's very important to get all the care you need to be as comfortable as possible. As you begin to think about stopping dialysis, you may want to also consider other treatment options. Maybe you can think about doing home dialysis if you don't want to go into the clinic and deal with that. Pain management, palliative care, or hospice care may make your symptoms more manageable. So they got palliative care, and that's what that's designed to do. Medications may be used to keep your fluid and swelling down, like Lasix. They may get that to you to have you keep urinating. Now, if you are in pain or distress, talk to your doctor. They can give you prescribed medicine for the anxiety and the pain. They may even help you live remaining days as comfortable as possible. And let's talk about spiritual concerns, as Brother Moses mentioned. People of different faiths may wonder about the impact of choosing to go without treatment. It is usually best to talk to your spiritual leader. They will be able to provide insight from your faith's perspective. It's only a perspective. If your spiritual leader isn't available, try to reach out to someone on the care team so they can put you in touch with one of your people that's practicing this faith. Now, let me say this. Choosing to go without dialysis is a very personal decision. It's a big and difficult choice. Take the time you need to choose. Talk with your doctors, family, friends, and spiritual leaders. Try to learn as much as possible about your options, your other options, before choosing. Because again, you got transplant, you got outpatient hemodialysis, you got home dialysis, home hemo and peritoneal. You got nocturnal dialysis, where you do it in center for a longer period of time at night. And then you got conservative therapy. And unfortunately, some of these treatment options are not available to people such as Brother Moses and our fellow warriors in East Africa. Talk about that, Brother Moses. I mean, really, over in Kenya, where you're at, you really only have pretty much one option. I mean, and that's in center. Is there home dialysis option there?
Well, home dialysis is not something common in Kenya. Maybe for a few hospitals, top-notch hospital, just the hospital for the who is who, and otherwise for the general public, home dialysis is still a pipe dream. Now, even the government insurer does not cater for any package related to home dialysis. Is purely in-center hemodialysis that is catered for by the government and is the most common all over in Kenya.
Wow. Wow. You can still hear me, Brother Moses?
I can hear you.
Okay. All right, the screen froze up. Let me try to refresh.
But again,
I'm sorry, what was you saying, Brother Moses?
But again, when it comes to conservative therapy, there are inroads because the big hospitals, most of private hospital, you will see they also have a palliative care wing, or sometimes they call it home care. Yeah, so you will see that palliative department existing within maybe referral hospitals. And I will say that is just part of conservative therapy.
Okay.
Okay. Maybe you are put there if you are you've chosen conservative therapy. And basically, this one happens when now they see that your days are numbered. That is the truth. And you go there as you wait for your end of life. And that is where you will meet your spiritual leaders and maybe few care physiological and physiological needs that that you will get, which is of importance until your end of life. Back to you, Steve.
All right, thanks for that, Brother Moses. So look, again, when you're thinking about this, think about the impact of your choice on loved ones, but also have the courage to do what you think is best. Okay? Now, you can talk to your social worker if you're watching here in the United States. I know they don't have social workers in Kenya, but talk with your social worker, doctor, or member of the care team. And they can help you learn more about different treatment options available as we discussed, including stopping dialysis. So let's talk about the aspects of conservative therapy, what's involved. So as we mentioned, conservative therapy, also known as conservative management or non-dialytic management, is an approach that focuses on managing symptoms and improving the quality of the life for individuals with advanced kidney disease who chooses not to undergo kidney dialysis. It's an alternative to dialysis for certain patients, especially those with multiple comorbidities or other issues, medical issues, or a limited life expectancy. Okay. Now, we're going to talk about some aspects of conservative therapy for dialysis. 1, medication management. Medications are prescribed during conservative therapy to control symptoms and manage complications associated with kidney disease. This may include medications to control blood pressure, manage anemia, treat mineral and bone disorders, and alleviate symptoms such as pain or itching. Because that itching is going to come from the buildup of the toxins, the phosphorus. And then this is where we go into number 2, dietary modification. So if you decide, hey, I'm at stage 4 or beginning of stage 5, and the doctor wants you to begin ready to start thinking of dialysis, you can say, well, look, I want to try conservative therapy for a while. Let's manage my symptoms. And then this is where dietary modification could come in. Having a renal dietitian can help create a personalized meal plan for you. Again, this is not a one-size-fits-all. That's why they say a personalized meal plan that limits the intake of certain nutrients such as sodium, potassium, and phosphorus. This is to reduce the workload on the kidneys. You don't want to put too much workload. They're already at a disadvantage. Fluid intake may also be restricted to prevent fluid overload. So if you think about conservative management and you at stage 4, you really got to tighten down. It can be done. I've seen people do it. I've seen people at stage 5 hold off dialysis for 2-3 years. At stage 5. So what can be done is how intentional are you going to be in keeping this disease from knocking on your door? Number 3, fluid management. Monitoring and controlling fluid intake is crucial. That's what they put down here. It's crucial to prevent fluid overload and associated complications. This may involve limiting fluid intake and monitoring your weight regularly to ensure fluid balance. That means get yourself a scale. Order from Amazon. Monitor your fluid, your weight gain. Measure your urine output. Get yourself one of those urine containers that got the numbers on the side. And see how much you're urinating. See if it's starting to, you're urinating less or more. This is what it means to be intentional and be in front of this disease. But a lot of people don't know this or thinking about it. Okay? Number 4, symptom management. Conservative therapy focuses on managing symptoms such as fatigue, nausea, pain, and shortness of breath through various interventions, including medications, lifestyle modification, and as Brother Moses put it, palliative care. And one of the biggest ones, number 5, emotional and psychological support. Dealing with advanced kidney disease and the decision to forego dialysis can be emotionally challenging. Support from healthcare professionals, social workers, and support groups can help individuals and their families cope with the emotional aspects of conservative therapy. Now, you see they put support groups, but you have on social media, we got everybody's human, but you got some support groups, or somebody go and mention that they're thinking about conservative therapy. You got half of the support group trying to convince them not to do it. But again, they're not in that person's shoes. And you got other people criticizing someone not wanting to do dialysis, or even not deciding to take a transplant. This is that person's decision, not yours. Focus on what you would do. But you have these groups where, again, you have critics who are dealing with the same disease and going to criticize another warrior on the decision that they decided to make and share with the group. If someone decided to forego, say, I'm going to stop dialysis, this is the time that you support the person, not criticize. So, support, I got that. So again, it's important to note that conservative therapy is not suitable for everyone with advanced kidney disease. Okay, it may not be, you may say, okay, nah, I don't want to do it. And that's okay. We're not trying to convince you. We're not trying to convince anyone here to do conservative therapy. we just letting you know that that's another option, and that one should not be criticized on choosing that treatment option. Whether other people believe it's the right thing or not, that's their personal choice. And so again, it's important to note that conservative therapy is not suitable for everyone with advanced kidney disease. And the decision to pursue this approach should be made in consultation with the kidney doctor or healthcare team. The treatment plan should be tailored to the individual's specific needs, preference, and goals of care. Regular monitoring and follow-up are essential to ensure that symptoms are managed effectively and the treatment plan is adjusted as needed. And so we got one more that I want to do, but I want to hear from you, Brother Moses, before, because we got 15 minutes left, and we're going to talk about the emotional and psychological aspects of conservative therapy. All right, so any words, comments?
Absolutely true, Steve. Absolutely true. Because the decision not to do dialysis or to take this conservative therapy It should be personal, and no one should criticize about it. I like the way you put it sometimes, that you don't ask, they don't talk about it. Right? If all of us can be educated and be aware of this option, then I think one can make arrangement with their kidney doctor, or that is the nephrologist, and to make adjustment before going into that route, and even some form of counseling to the caregivers and to their support systems that is available. Back to you, Steve. Yeah.
All right. Thank you, Brother Moses. I appreciate your comments. Very important, very important. So let's talk about the emotional and psychological aspects of conservative therapy, because this can be significant for both patients and their families. Now, here are some common factors to consider. 1, adjustment and acceptance. Choosing conservative therapy means accepting that dialysis will not be pursued. This decision can be emotionally challenging and may require time to adjust to the idea of managing kidney disease without dialysis. It may involve feelings of loss, grief, and uncertainty about the future. Now, when you look at these feelings, that can go across the board with transplant, hemodialysis, peritoneal, and home dialysis. Any type of treatment, intervention, or regimen, medical treatment can involve these common symptoms. Common feelings of loss, grief, and uncertainty about the future. Number 2, the quality of life. Conservative therapy aims to improve the quality of life for individuals with advanced kidney disease. However, there may be concerns about the impact of symptoms and limitations on daily activities, social interactions, and overall well-being. Coping with the physical limitations and adjusting to a new lifestyle can be emotionally challenging. See, this is nothing to play with. Somebody could be on here right now in their family trying to make that hard decision if they should do dialysis or not, and what other options they may have. And there's no other show or people out here talking about this. They could care less. They're going about their day-to-day life. And that's why our brother Moses and Brother Moses in Kenya just had dialysis treatment yesterday. And in Kenya, they're only allowed 2 days a week at 4 hours. And he's on here today sacrificing his time, his energy. He could be sitting, laying down, resting, enjoying his day off from dialysis, but he's on here just as myself. I could be out doing something at the park or somewhere just chilling. But I am going to the park after this, but I'm going walking to focus on my health. But I was just on here last night talking about this. Saturday night. Could have been out at the club or something. I don't go to the club no more, but I'm just saying. We're on here trying to get this information out there, talking about it, because we know the devastation of kidney disease and the impact it has on families and people diagnosed with this. So let's look at number 3, decision making. Deciding to forego dialysis and pursue conservative therapy is a complex decision. It's not something you go to sleep and you wake up. It's like sleep on it. It ain't like you go to wake up and you can make the decision of not to do dialysis or do it. This is a complex decision that involves weighing the potential benefits and drawbacks. Again, you may have somebody that has cancer that metastasizes all through the body, and they in excruciating pain daily, and then they still got to go to dialysis 3 days a week. What would be the drawback of not doing dialysis? But what would be the benefit? For some people, the benefit would be not doing dialysis, a life free of pain and suffering. So patients may experience doubt, guilt, or anxiety about making the right choice for their health and future. If you got cancer and it's metastasized, and it's evidenced by, symptoms of no weight gain, and you lost weight, lost your appetite, and you can physically see it, there's no future. And that's unfortunate. These are the hard decisions that one has to make when dealing with terminal illness. Emotional support. Patients and their families may benefit from emotional support to cope with the challenges of conservative therapy. They don't need to be criticized. It's already hard for them now making this decision. And now you got somebody else why are you doing that? Why you don't want to? But anyway, this can involve counseling, support groups, therapy sessions with mental health professionals to address feelings of anxiety, depression, or stress related to kidney disease management. Let's look at communication and family dynamics. Conservative therapy decisions can have a significant impact on family members and their roles in providing support. Open and honest communication is crucial to ensure that everyone understands the treatment plan and can provide the necessary emotional support. So if that's me, and I don't have it, but I'm saying if I had a terminal illness, and I got grandkids, 2 grandkids, and daughter that's 14, I'm gonna be honest with them. Hey, this is what's happening to Dad. I can't do this no more. I need y'all to be support your dad, or whatever the case. This needs to be a family thing. Because if I'm in pain every day, am I going to negate my feelings for my family? That may be hard to say or hear. But why am I going to be in pain every day just to make somebody else happy? Or for their emotional support, and I'm in pain suffering. In number 6, which is the last of some factors to consider, end-of-life planning. Conservative therapy may be chosen by individuals with limited life expectancy or those who prioritize. Now listen to this. End-of-life planning, conservative therapy may be chosen by individuals with limited life expectancy or those who prioritize comfort and quality of life over prolonged medical intervention. Okay, you got some people, let me repeat that, who choose to prioritize comfort and quality of life over prolonged medical interventions. And what does that mean, Steve? That means they may just want to, whatever time they have left, spend it with family, spend time with them, do this, do that, make sure they comfort, instead of maybe going to dialysis 3 times a week and cramping, or going to chemo, or doing this or doing it, just tired. Let me just spend the rest of my time left with my family, enjoy this time. And so this can lead to discussions about end-of-life planning, including advanced care directives and palliative care options. So, as we come to an end, it's important for healthcare providers, including myself and advocates, to address the emotional and psychological needs of patients and their families throughout the conservative therapy process. Okay? Even right now, it's a young lady on TikTok that's decided to forego dialysis. She still needs support. This may include regular check-ins, referrals to mental health professionals, and providing resources for support and counseling. Remember, each individual, Brother Moses, people watching, people on TikTok, even myself, each individual's experience is unique. Okay? What may work for one may not work for someone else. What may work for someone else may not work for somebody else. So each individual's experience is unique, and a personalized approach. Got to be personal to emotional and psychological support is essential. Brother Moses, any comments before we
Very true, Steve. Let me add on that the personal decision to take conservative therapy is not suicidal in any way. This is scientific. It is also just a way, a treatment way, methods that are there, that is there after dialysis and transplant. So the third one is you can either choose to have dialysis, or or not to have or to have dialysis. So when somebody think of it, remember this is quite much scientific, and it doesn't mean that your care team shall stop providing some care. In fact, they will sit down and design the care that you need at that moment. Thank you, Brother Steve.
Absolutely. And thank you for that, Brother Moses. And let me just say this. A lot of times when people start dialysis, they have in the consent form, the art of medicine. The art of medicine is not an exact science. It's not. So that's why they had a different treatment options. If you're watching this, or you're a family member of someone who's about to start dialysis, or you're about to start dialysis next month, or it's in the future, you're at stage 4 or 5, and you're fighting, you're holding it off as much as you can. Just know that you have different treatment options. You can do a preemptive transplant where you find a donor before you start dialysis. You can get a transplant. You still got to go through that process, but see, that's a lot here in the United States. The kidney doctor don't tell patients, hey, do you know, they could be in stage 4, about to trip over to stage 5, and say, none of the kidney doctors be like, hey, did you know you can get a kidney preemptive? Try to get on the list before you hit dialysis. But again, a lot of people don't know about it. But you got some physicians that do tell their patients. But for the most part, you got a lot of physicians that don't say a word. They keep their mouth zipped. Again, you don't ask, they don't tell. And that's why you see a lot of people on dialysis. You're like, why you didn't tell me that I could get on the transplant list before I get on the machine? I knew somebody that wanted to donate. Now they don't want to. Or I had, you just never know. And so if you don't have that information, then you won't know. So there's preemptive transplant before you get on dialysis. You got hemo, outpatient, home hemo, peritoneal, which is home, which is dialysis through the stomach. You have your transplant, and then you have conservative therapy. And a lot of times you don't hear about conservative therapy because a lot of times I feel like these doctors just want to put you on treatment and not consider other alternatives before it gets to that point. So, Brother Moses, do you have any final comments before we end this broadcast?
Well, I think doctors should have at least time to explain the various treatment options, because not only doctors but the entire care team, so that when you begin any form of treatment, any form of therapy, then you are well versed of what you are going through, and that will really be the most liberating thing, Brother Steve.
All right. But before we close out, I just want to address one comment. I want to thank NG, who tuned in from YouTube. Thank you for your comment and hello. NG says that calcium buildup removes me from the transplant list. Now, This is why. Now, I don't know the situation with this young lady, so I'm not speaking on her situation, but I'm speaking in general of why controlling your calcium and phosphorus is very important. Because this young lady was removed from the transplant list because of calcium buildup. Now, she's not the only one. I've heard of many people, they had calcification around their heart, so that rendered them ineligible for a transplant. That means they can't get a transplant. They have to stay on dialysis for the rest of their natural life, or if they decide to come off dialysis. But they can't go the transplant route because their heart has calcification. Now, this all starts when kidney disease starts popping up. This is why taking the phosphorus binders is very important in keeping your calcium in control. Because when the kidneys are not working, now it impacts the vitamin D production. And then you have the seesaw effect of the calcium and phosphorus, or overproduction of PTH, which draws calcium out of the bones. So this is no joke. And shows like this are very important because, again, there's no one getting up Sunday afternoon speaking of kidney disease topics that could be very important and crucial for a lot of people. And I'm thank you, NG, for hanging around. I'm glad you're still here. And I hope that issue can be resolved and you can get back on the list. And thank you for watching and tuning in. Please follow, if you haven't already done so, please follow Steve the Kidney Nurse on YouTube and Facebook, and also go to the FIGO Initiative on Facebook page. It's an international page that's ran by Brother Moses, the Kidney Ambassador. So with that being said, we'd like to thank everyone for tuning in to today's show. I'd like to thank NG, Miss Elizabeth Oldham, Virgil Jones, Latasha Gardner. Thank you, Latasha, for your unwavering support, and Miss Elizabeth for your unwavering support as well. And we'd like to thank everyone for watching today, as we will be back next Sunday, a new episode and topic right here on Kidney Hub East Africa. Brother Moses, do you have any parting words before we end the broadcast?
A very thank you to all of you who are watching and supporting this program. We are glad you are watching, and we'll keep on making it better each and every Sunday. Keep watching every Sunday, same time, same hour. Thank you, Brother Steve.
All right. Also, if you're over in East Africa, please share this broadcast. If you're in East Africa right now watching this, please share the broadcast. Bring your family members, your loved ones that may not understand kidney disease and the treatment process. Bring them to the show. Come with your questions. You can reach us through Messenger. You can go to my webpage, SteveTheKidneyNurse.com, and send a contact me to Express if you want certain topics discussed. That's what we're here for, to spread knowledge and awareness. So with that being said, I'd like to thank everyone for watching. Brother Moses, it's been a pleasure having you on the show as well and taking the time from your schedule, because like I said, you could be resting right now. Okay, it's 9 o'clock Brother Moses time, and he's up doing this broadcast. So thank you guys for watching. Tune in again next week for a new broadcast, and we see you then. Brother Moses, I'll see you later, and have a great week and a great treatment at Dialysis on Tuesday.
Thank you, Brother Steve, and do have a great day.
All right, you too. Thank you, everyone. God bless and take care. Peace.